For those of you who are awaiting test results for COVID-19, please check the Ministry of Health's online portal or the link on our website. Please remember that while you await your results, you must remain in self-isolation. I will now share the most current case counts. There are 63,496 confirmed cases of COVID-19 in Canada and 18,722 cases in Ontario. Chatham-Kent has 89 cases, and Sarnia-Lambton has reported 193 cases. Michigan now has 45,054 cases, with 9,536 cases being in Detroit. Today, we are reporting 674 cases of COVID-19 in our community, an increase of 9 cases from yesterday. 41% of our cases have occurred in long-term care homes, including both residents and staff. 229 cases have resolved. 18 people remain in hospital. 16% of our cases are between the ages of 20 and 29 years. 16% of the cases are between 50 and 59, and 21% of our cases are 80 years and older. 41% are male, and 58% are female, and 1% is unknown at this time. Our community has lost a total of 57 people to COVID. 43 deaths have occurred among residents in long-term care and retirement homes. Our health unit is currently working with 11 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Common symptoms include fever, a new or worsening cough, shortness of breath. However, other symptoms may be present, such as a sore throat, unexplained fatigue, an increase in falls, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit eHealthWindsor-Essex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone, and thank you for tuning in. The provincial government continues to slowly release restrictions for businesses across the province. Yesterday's announcement included the ability for retail stores with a street entrance to have curbside pickup available, and other stores such as garden center and hardware to allow in-store activities starting this weekend. As many of these businesses and facilities have been closed with very limited number of people attending to these services, there may be some reasons for these facilities to ensure that the water that's been in the facilities has been sitting for some time, to make sure that you do appropriate flushing before you start to drink those water. Some of those guidelines are available on our website through our utilities partner, Enwin Technologies, as well. I continue to urge everyone, when you're there in these stores, employees, patrons, to practice physical distancing. Wash your hands regularly with soap and water or sanitizers. Stay home if you are sick, and limit trips to only what is necessary. The COVID-19 pandemic is not over, and we must all continue to do our part to maintain the safety of our community. Today is Child and Youth Mental Health Day and Mental Health Awareness Week. Research has identified that 70% of mental health challenges have their onset during childhood or youth. 1 in 5 children and youth in Ontario are dealing with a mental health challenge. COVID-19 is a difficult time for children and youth. During this time of uncertainty, children and youth are exposed to unfamiliar situations and rapidly changing conditions that can be difficult to cope up with and understand. For example, the loss of school friends, extracurricular activities, and sports, and limitations on their mobility. A recent study released on May 6th by Children's Mental Health Ontario and Addiction and Mental Health Ontario identified that more than half of parents have seen behavioral changes in their children since the start of COVID-19. It ranged from extreme outbursts and irritability, drastic changes in moods, behavior, or personality, sadness, and difficulty in sleeping. These type of changes in mood and behavior can be a sign of mental health. Parents also reported that their children felt stressed to the point of impacting their daily lives. Parents, guardians, teachers, and other adults in lives of children and youth play an important role in helping them cope up with these challenges. To help support children's mental health and well-being during this pandemic, you can take several actions. For example, talk to your children and youth about COVID-19. Keep a regular routine. Limit exposure to news and overly negative media. Encourage social connection and engagement. Make sure they get time for physical activity and support healthy eating. Seek help for any mental health concerns by reaching out to local professionals or your healthcare providers. For children and youth, this time of social distancing and rapid change can be challenging. So much of the childhood experience is about building social connections, relationships, and learning. We know that children and youth have at least one trusted adult that they can talk to and has a positive impact on their mental health outcomes. It is critical today and every day to listen to your youth, support, and guide them through this. Thank you.
We'll now take questions from the media. We'll start with CTV.
I'll get the first one today. My first thought is you have to be worried about this weekend with the opening of people being able to cruise indoors. And, as a chief medical officer, I would be afraid.
Definitely, and I think it is why it is a good reminder for people to know that easing off these restrictions doesn't mean that everything is gone. We still need to be very responsible, and our community has been responsible for quite some time now, and I think people have learned many lessons during this time. When you're going out to these facilities, making sure that you are ensuring that physical distancing piece is maintained. Staying home when you're sick. It's not a free-for-all show that everyone will start to go into these facilities. There are some restrictions in how many people can be in these facilities. So being mindful of that, and this is to make sure that people are doing their physical distancing piece. When you're out in the store, it's better you don't wander around. You gather your stuff, you pick up, you leave, because that's what it means, that you do the work that is necessary, and it's not something else. And ensuring that, when you're interacting with other people, even the staff in those facilities, ensuring that you are doing it from a safe distance and still following all those guidelines that we've been talking about: hand washing, respiratory etiquette, and if there are concerns about not meeting the physical distancing piece, considering maybe wearing a cloth-based mask, as in many places that we have said that if it's difficult to maintain physical distancing. So things like that, it is important that people should remember, and these are all about those facilities. And every time when we are out and about in the community, we want people to follow that.
Any questions from AM 800?
The outbreak in the 11th long-term care home, I understand that's a resident, not a staff member.
That is, yes.
Is that a little unusual? Usually first detected in a staff member, which spreads to a resident?
It is unusual, and we are getting all that data and trying to figure out what could have led to that case. And so that work is being done. Sometimes it's very difficult to get that answer because we are unable to pinpoint exactly what happened, but that's definitely an important one, and we've been talking about it when we became aware of the case.
Thank you.
Any questions from Windsor?
Yeah, just going back to that long-term care home, Chartwell, Kingsville. Did that resident? Sorry, I'll come back to that.
Any questions from the Windsor Star?
It looks like a pretty significant number of tests came back yesterday. Was there any increase in the number? I'm just trying to do the math in my head quickly here.
The test results that came back, yes, as I said, that the capacity, these labs are constantly increasing, and they are developing better mechanism to transport these specimens to the labs that are able to test them. So all these efforts are happening right now. I am aware that we did a number of testing yesterday too, and a lot of them, the pending results came back to, and Teresa gave all that number, and it is definitely encouraging, but as I said, there's still a lot of work that needs to happen to make sure that we or to get us to the point where we feel comfortable that everything is working well. I think there's still some work that needs to be done.
So tentatively, we're feeling a little bit better, seeing some improvements, even that you were mentioning yesterday and the day before, but more work needs to be done.
Absolutely, yes.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Chartwell Kingsville on the Health Unit's website is calling it a long-term care facility, but I believe it's a retirement home.
We can look into it and make sure that we can correct it if that's the case.
Because that's what it was yesterday. It said retirement home.
Okay, we'll that correction as necessary.
Do they have the same rules that the long-term care facility has right now?
Same rules with respect to they have like different no visitors, yes, so they are following the no visitors policy as well, and also with their staffing they have to follow the guidance of signage and restricting number of visitors, ensuring that they have their staff are wearing the mask as universally recommended.
Are staff allowed to leave the facility, or sorry, a residence, if it's a retirement home?
To my knowledge, I think they're all expected to be at the facility instead of leaving, but it's something that we can't control. I'm expecting that that's being followed.
Okay, thank you.
Any questions from Blackburn?
Yeah, do you have an idea, or do you know how many homes, long-term care or retirement homes, have completed their initial testing, and how many more you still need to do? Like, what percentage of long-term care homes have been tested in the region?
So specifically, based on the Premier's direction, we have completed more than, I believe, 75% of the long-term care homes already been tested, all the residents in that facility. And we are, even though the timeline to complete those tests was May 15th, but we're expecting that either we finish this weekend or early next week to complete all the swabbings in all the long-term care home and retirement home. Some of that swabbing is done by the EMS in collaboration with the Windsor-Essex County Health Unit and also our hospital partner, and some of the homes are doing their own swabbing. A combination of all of that, we're expecting either this weekend or very early next weekend to complete well in advance of the timeline that was given to us.
And I think you've explained this before, but once you've completed all of those baseline tests, how do you use this information moving forward?
So I think that's a baseline information, as you rightly pointed out. It gives us a point in time of what is happening in these facilities. The hope is with many of these restrictions and limitations on how these facilities are operating, the hope is we are in a much better position to contain that high-risk population from not getting any disease in this population come to them, basically, in the first place. And then we can go back to possibly the model where we will continue to do the active surveillance that all these long-term care homes and retirement homes do, to including daily temperature check twice a day and looking for active sign and symptoms of COVID, whether we are talking about typical symptoms or atypical symptoms, and then acting appropriately on time to get those additional testing done. So some of those decisions will be made locally, and some of these directions may come from the province too. I'm not sure that we have gone that far yet, but from a local perspective, we definitely want to continue to work with these facilities. These are not one-off testing. We have been doing this for many years now, that even with the influenza and everything, our staff and our team is in contact always with these facilities, and to make sure that they're getting the right support, including infection prevention and control, all the guidance from the outbreak. We do provide regular training on outbreak management and following everything that they need to do from an active surveillance perspective, and seeking out public health support as needed. So we'll continue to do our work even when we finish all this swabbing in these facilities.
Was the resident that came positive at Chartwell Kingsville, was that due to some of your surveillance swabbings, or was that due to symptoms that they were tested?
My understanding is it was part of the surveillance swabbing.
Any further questions from CTV?
We're talking about swabbing. I'm just curious. I was at the OLA campus yesterday, and I noticed that the lines aren't as big. Do you have numbers? Are people going to the assessment centers, here in the Erie Shores?
Those numbers are typically tracked by the hospital themselves, all these assessment centers. But as I mentioned, I think yesterday, we anticipate that there's between 80 to 100 people who are going to these assessment centers, and the testing is happening there. There is no indication or recommendation from us to not to go there. If you feel that you have signs and symptoms and concerned about COVID, go to the assessment center. And there are healthcare providers who will assess you based on your symptoms, based on your presentation, and then may choose to swab you if they feel that there's a clinical suspicion of COVID, and they will do what is needed. So assessment centers are there for people, and you also have other options. You can go do the online screener. You can visit, you can reach out to Virtual Health, eHealth Windsor-Essex, and then maybe get an assessment there and get some recommendations from there. So there are multiple options for people to access those services that exist in the community.
Any further questions from AM 800?
I just wanted to follow up on Maureen's question. You said 75% have already been tested when it comes to the long-term care homes and retirement homes. Is that residents and staff have been tested?
So this 75% is mainly the residents in these facilities, and if we make that comparison, I think we're talking about between 50 and 60% of the residents in each of these facilities. The staff in each of these facilities. The challenge with the staff is when the team is there, they not everyone, because some of these facilities work in 2 or 3 different shifts. Not all the staff are on site for the testing, and then the recommendations for those staff to go to either an assessment center or the facilities to do the swabbing for themselves. So our process is very good with respect to the residents. For the staff, I think that's something that it's a shared responsibility as we feel, and we are trying to provide as best support to these facilities to get everyone done.
Okay, thank you.
Any further questions from Windsor 8?
I'm okay, thanks.
Windsor Star?
No, thank you.
CBC?
Yes, one question. The person that tested positive in Kingsville, you're saying the test to get them back takes between 6 and 7 days. So that means Chartwell would have been in outbreak for the last 6 or 7 days. You're counting the 2 weeks. I just want to make sure you're counting 2 weeks from the day you get the test results back, even if it's taking more than 3 or 4 days.
As I said, I don't have the specifics that how long it took us to get the results back. Most of these facilities are long-term care home people. They are prioritized by the lab to get the results quickly, and I don't have that number that how long it took. But technically, anyone who is showing symptoms, and as I said, there are a number of measures that are already in place. Having a case, especially if it's asymptomatic, doesn't necessarily mean that the transmission is happening. If people are using the appropriate PPE, following the right infection prevention and control measures, so it doesn't necessarily mean that the spread happens unless there's an evidence to show that. The homes and the facilities, they are aware of all these infection prevention and control measures to protect their staff, to protect their residents, even when the facility is not in an outbreak. So I think yes, the facility is now declared an outbreak at this time, but it doesn't necessarily mean that they were not following everything that they should in between the time that they were waiting for the results.
So is it you always wait for the results and then you will put that as date of the outbreak as opposed to the date the person was tested?
I'll have to double check. I think it goes back to the either symptom onset or the date of specimen collection. I think especially if it's an asymptomatic case, then we go to the specimen collection date rather than the date of symptom onset. But if we have the symptom onset, we use that date.